Alright, I'm going to do my head to toe assessment. It's Teresa Morris. We're going to do your upper arms first. Feels warm, tan, my hands are cold. Skin is soft. Skin turgor is good, well hydrated. No lesions, not diaphoretic, not edematous. Some tan lines, but other than that, looks good. And then the legs. No swelling, no edema. Good skin turgor. Not diaphoretic on those, no lesions, no masses. Skin was warm. No viscosities. Good hair distribution, male pattern distribution. And then the nails. Wrist capillary refill less than 3 seconds. Skin is warm. Nails adhere to the nail bed. They're rounded. Nails are rounded, smooth. And no clubbing of the nails. And no ridges, no opacities. And the head is normal cephalic, symmetric to the rest of the body, no ticks. Round. And scalp is healthy and freely movable. Is there any pain, any tenderness?
No.
And the hair is thick and brown and coarse, and it's clean. The face is smooth and warm. The maxillary sinuses. Does that cause any pain?
None.
How about here?
None.
And then if I tap on it, does that hurt at all?
None.
How about here?
Not at all.
And then if I check for TMJ, if you move your jaws up and down, does that hurt at all? No clicks, no crepitus.
No, not at all.
Good movement. And then cranial nerve 5, which is trigeminal. If you'll clench your teeth together, and I'll palpate. Does that hurt at all?
No.
How about in here?
No.
No. That's the masseter and the temporal. And then if you'll close your eyes and tell me when you feel something.
Yes. 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 Yes.
All right, that was sensory. And then keep your eyes closed. Tell me when you feel something.
Feel it. Yes.
What do you feel? Is it
Dull. Dull.
right? And then cranial nerve 7, which is facial gymnastics. If you'll smile, showing your teeth, and then without your teeth, and then frown, and then raise your eyebrows, and then close your eyes. And I'll try to open them. All right. And then show your teeth, puff your cheeks, and then purse your lips, and all those within normal limits. And then cranial nerve 2, which is optic. Use the eye chart. This is a small one, but tell me the smallest letter you see.
Z-O-E-C.
Okay. And then we would say that your vision is 20/20, 20 feet from the chart. And that's the Snellen test. And then the Rosenbaum is similar. The Snellen is for distance, and the Rosenbaum is for near vision, though. And the Rosenbaum, you would say that the vision is 40/40. 14/14, I mean, from the chart. The chart is closer because it's near vision. And then the peripheral vision, you cover one of your eyes and tell me when you see the bunny.
No. No.
Okay. And that tests peripheral vision and confrontation. And then extraocular movement. Cranial nerve 3 is oculomotor, 4 is trochlear, and 6 is abducens. The 6 cardinal positions of gaze. I will be testing your eye movements and muscles of the eye. Keep your eyes still while you follow my pin. All right, and that was the H method. And then I'll do the wagon wheel. I'm checking for the corneal light reflex And I see a twinkle in your eye there. And then if you'll cover one eye with a card, just look straight ahead and cover the other one. And they look like they're fine, they follow. All right. And then looking at the eyebrows, they're symmetric and they follow to the outer canthus of the eyes. The hair distribution's even. Eyelashes are brown and full and they curve outward. No drainage, no flakes from the eyes. No lid lag or ptosis. The eyes are symmetric. If you look up and then down and then side to side. Conjunctive eyes, moist, clear, and small blood vessels in there, just looking at it. Lens is clear and sclera is white. Irises are round and both are the same color, they're brown. The cornea is clear. Position of globe is straight. The pupils are equal and reactive to light. And accommodation. Convergence. Can you look in and then out with your eyes? Yeah. And constriction. They converge and constrict when I get closer or further away with more light. Yeah. And then I'm going to palpate the lacrimal sac and let me know if it's any pain at all.
No pain.
No swelling, no tenderness then. And we'll look with the scope for cranial nerve 2. Look at the eyes, I mean. Let me turn it on. There you go. The optic disc is round and oval. Yellow-orange depression with a distinct margin. The retinal vessels are red. The macula is the darker circle in the middle. The fovea centralis is a small white spot located in the center of the macula, which is the area of sharpest vision. All right, and then I need to change that. To the ear one. All right. The auricle of the ear is the outer part, and it's normal and rounded and flexible. And the mastoid is adjacent to the middle ear. And it looks normal, intact. The external part, the opening of the cartilage looks fine, the ear canal. And I see hairy projections and a little bit of cerumen. See the cone of light. All right, the umbo, the malleus, the parathalacia. And then we can do the whisper test. If you'll cover one ear.
It's sunny today.
Okay, whisper test, so your hearing was good there. And then the Weber test. Tell me when it stops.
Stops.
Okay, there's no lateralization. Could you hear it louder on one side or the other?
The same.
No. Okay, and then we'll do it in here. No, I don't hear it good there. Tell me when it stops.
It stops. It stops.
So I did it in the front and the back of the ear, which is the Rhine test for hearing conduction. Air conduction is greater than bone conduction by 2 to 1. Then we go to the nose. The nose is symmetric. It's midline to the face. If you lean your head back, the septum is in the middle, the turbinates. Look midline. The nose is rounded and smooth. Mucosa is pink and moist. Turbinates are on the midline. There's no foreign objects. If you'll put your finger on there to check the patency of one side and then the other side. Any trouble there? Any trouble breathing? Any stuffiness? Anything?
No.
And then cranial nerve 1 is olfactory. If you'll close your eyes. Tell me what you smell.
Cinnamon.
All right. And then we do your mouth. Look at the lips. They're not chapped. They're pink, moist, no ulcerations. And the teeth, they look clean, no cavities, no dental work. Gums are pink and moist, no ulcerations. Tongue up and down. Sublingual looks good. Frenulum is in the midline. Tongue up. Yeah, it's underneath the tongue. There you go. And then the Wharton's ducts are palpable with salivary glands under your tongue. The Whartons are on the lower and the Stinsons are on the right. The upper and the lower, I mean, on both sides of the salivary glands. Should be able to see them. Up there on the side and then they're in the middle. The Stinsons and Wharton's ducts, which are the salivary glands. The Stinsons are the ones on the top, the upper. The upper on both sides and the Whartons are in the middle underneath. The tongue is pink and moist with no ulcerations, no white patches. And the hard palate has rugae at the top. The soft palate moves up and down when you're talking. Say ah.
Ah.
All right. And cranial nerve 6. Cranial nerve 9 is glossopharyngeal. Cranial nerve 10 is vagus, and those are swallowing, speaking, and gag reflex. Cranial nerve 12 is hypoglossal, which is tongue movement. You can move your tongue from side to side. It's not easy to do. And then the neck, symmetric to the rest of the body. Palpate the cervical. Is that tender at all or hurt?
No.
And then the vertebra. Tenderness.
No.
Alright. And then range of motion of your neck, if you can move it in all directions. Does that hurt at all?
No, not at all.
And then strength of the spinal accessory muscles, which is cranial nerve 11. If you'll try to shrug your shoulders, it's resistance. Okay, that's strong. And turn your head from side to side. Just stop it. All right. And then try to touch your ear to your shoulder on each side without raising your shoulders. All right. And then we look at the trachea, the sternal notch, and in the midline, you can feel the rings of the cricoid cartilage. And then if you swallow, I should be able to see it, and I can get you to drink a little bit of water too. You can see it. Yep. So the thyroid is right there. Trachea is midline, symmetric to the neck, and then I can palpate the lymph nodes. The preauricle is in front, the ear here. Postauricle is behind, and then occipital, and then submental, which is also, and then submandibular, mandibular or submaxillary, and then tonsillar or retropharyngeal, and the anterior superficial, and then the deep cervical, and then the supraclavicular is down here above the clavicle. And then I look at the carotid arteries in your neck. It's not pulsating or anything. I can find the carotid pulse there. And then I can listen, see if there's any bruits. Like the bell. No bruits. And I palpated the thyroid already. There was no bulges, no masses. And you could see it go up and down when you swallow. And then listen with the stethoscope for bruits there. With the bell. For bruits there. That's all that one.